Hi everyone, my name is Brian Garibaldi and I'm the Director of Lake Cook Behavioral Health. On this video, we're going to go over 5 common questions people have regarding ADHD. This will be a great video not only for clinicians, but especially for everybody, just to get a starting point of some common questions people have. So as I said in the intro, I'm the Director of Lake Cook Behavioral Health, but I also see clients. I have my own caseload, and one of the specialty niches I have is children, especially boys that have ADHD. So I'm going to go over some common questions. I'll throw in a little bit about myself and how I handle stuff and treat people as we go here. But let's go ahead and kick off the questions here. One common question people have, or when they talk about it, is what's the difference between ADD and ADHD? Well, ADHD refers to Attention Deficit Hyperactive Disorder. ADD was actually, it's a slightly older designation that says Attention Deficit Disorder, and people often use them interchangeably. The DSM is actually removed. The DSM is the manual, the official manual of diagnoses. It has actually removed the ADD designation, and now it's ADHD without hyperactive traits. Most people don't need to focus on that too much, but it's good to kind of understand. There's 3 main aspects that are commonly categorized as far as behavior and symptoms of ADHD, and those are hyperactivity, impulsivity, and distractibility. And I think with children especially, it's good to identify if your child is easily distracted, or they're not as distracted, or it's mainly hyperactivity, and they're kind of buckets to kind of do some analysis to kind of help steer our treatment and understand what everyone's going through. So basically, ADD was a previous designation for without hyperactive traits. So mainly people with a bad distractibility. And as I said, now it's referred to as ADHD without hyperactive traits. All right, question number 2 is, how is ADHD diagnosed? This isn't a complicated question, but I'm going to start with usually how it's done. Most diagnosis for ADHD is done through what they call psychological testing, of more comprehensive psychological testing mixed with reviews that are filled out by parents and teachers and the like. So there is some cognitive tests that can be done, but it's kind of partnered with a more subjective analysis of is this person able to stay on topic? Can they sit down and do things and aspects of their hyperactivity? And there's various tests and questionnaires that kind of do that. So except for some of the cognitive tests, some of the assessments are a little bit subjective here, and that's just part of it. There are more neurological tests called the QEEG and some tests that people with biofeedback do that I hope to get into more deeply in a later video that's used. But most commonly, it's done through these reviews, these questionnaires mixed with cognitive assessments. All right, question number 3 refers to what are the positive or negative qualities of ADHD? Kind of as I said in the earlier question, there's 3 main categories: hyperactivity, impulsivity, and distractibility. Hyperactivity can come across in multiple ways. Generally, people who are, some people could be hypermotor, very fidgety. Some people always need to be moving, always need to be doing things. There's many classifications of hyperactivity. Some people just have kind of hyperactive minds and active brains. Impulsivity really refers to what sounds like impulse control. Sometimes this means people need to touch things, they need to grab something. Sometimes it has to do with impulsive thoughts. Some people with ADHD, they don't necessarily act out, but they have a lot of impulsive thoughts. The other category is distractibility. These are people who are easily distracted by something. And I know this can be confusing because it looks like the other symptoms, and it's for sure related. But usually the inability, especially in a quiet area, to sit down and be able to sit and focus. And usually this shows a lot during school. It's very common, around 3rd grade or so, where kids are expected to sit down a little more. There's all sorts of milestones, but where they need to sit down a little more is just one milestone where it kind of starts to show a little bit more. To me, all these characteristics really have to do with stimulus. I think the ADHD brain needs stimulus, and if it doesn't get enough stimulus, it starts making it on its own. Believe it or not, there are some positive qualities about this. I think people who can manage their ADHD can be very productive people, can really multitask, can get a lot of things done at once, as long as stuff is stimulating enough. I think it's very common for kids with ADHD to be like, well, my son can do all sorts of things and focus on all the time when they're interested in it, and then when they're not, to just not be able to do it at all. everyone kind of has this to some degree, but people with ADHD, it can be super extreme. In fact, people with ADHD can have something called hyperfocus, they call it, which is almost a superhuman power to be able to sit down and really focus on things. I'm not just talking video games, but really focus on things for like hours and hours at a time, to kind of, I say, sometimes superhuman level. So there are some positive traits, and plenty of very successful people have ADHD as long as they can manage it enough, and can be very, very productive. Sometimes people with hyperactive traits are very easy to notice who they are. Just think about your hyperactive friends who maybe did a little worse in school and have certain traits. Sometimes they stick out a little more. So some of the traits are really easy to see in people. So that's some of the positive and negative qualities. Let's go to the next question. Question number 4, does my child need to be medicated? This is a giant issue and question that I deal with all the time in my office. Often people come in and their child is not on medication, and they're asking, do they need to be medicated? And the short answer is no, they don't have to be, but some people have bad enough ADHD where it's really beneficial. So I think it's part of my responsibility to really process that with my clients. I have a background in chemistry and pharmacology, so I think I can do a little more education regarding these things, because there's all sorts of classes of meds that people can talk to the psychiatrist about. But people come in and they worry about putting their child on medication, especially the front line of medication is stimulants. Adderall and Ritalin types is the first line of medication used, and there's a reason for that. And so I'll get into some during medication here, but maybe I'll make another video later where I go into more deeply. The main medication treatments are stimulants, which really fall into 2 buckets, the Adderall or Ritalin category, or non-stimulants are now used recently. And non-stimulants have a kind of totally kind of different effect. So no, your child does not need to be on medication. There are times where the symptoms are bad enough and different therapies like talk therapy, play therapy is not as effective as we would like it to be. And in order for people to be baselined and really function at a level where they can start working on things, sometimes medication can really, really help. I've seen with some clients, medication really turn a kid's life around as far as their ability to sit down, focus, and I think a later question is going to talk about mood disorders, really kind of get them on track as far as the impacts of their ADHD, even beyond the initial symptoms. So no, you don't need to be on medication, but sometimes it really, really helps to baseline kids. I think in general, stimulants or diagnosis of ADHD in the past there's been a lot of diagnosing of it, and I know the general populace sometimes asks questions. Does this person really have ADHD, and does ADHD really exist? I think if you saw a child with real ADHD, you would really see that this is a real kind of biological issue that they're having, and sometimes medication can really set them off in the right direction. So that's the short version of it. It kind of leads to question number 5 that I have, which is the last and final question regarding ADHD. Often, I say this all the time to my clients when they come in, just so they have a real understanding. Clients often don't come to my office because their son or daughter has trouble with school, or they just can't sit down in school and do work. It's usually they end up in my office because of something else. Something's come along with that. It's not just their inattention. There's things that come with it when it's bad, or when ADHD has been a kind of a chronic problem for them. And these are that mood disorders, and we'll talk about depression and anxiety, can come with ADHD. I find it very common with people with ADHD to also have anxiety. And if you think about how the brain works and people with ADHD works, it kind of makes sense. People with hyperactive brains, hyperactive thoughts, I think can be much more prone to anxiety. So people usually kids and their parents usually end up in my office because they have a mood disorder that goes with it, often leading to depression or anxiety, and that's causing a dramatic impact, often in bad or escalating, I say bad behavior, but like, escalating behavior, resistance, rebelliousness, even more than, a child their age. So the mood disorders that comes with it is why they usually end up in my office. So sometimes treating ADHD also involves treating anxiety. And sometimes it's hard to know what is like primary or secondary, And that's kind of, I think, a good therapist can really start to work that out and work with the anxiety as well, because it really, there is some overlap. And I actually have another video I've done with another clinician here, Dave Margolis, LCPC, where we've kind of gone over this topic more that hopefully we can link to here somewhere in this video. So those are some 5 common questions regarding ADHD. If anyone has any questions, feel free to contact us, www.lakecookbehavioral.com.